The Sherpas of Nepal are known worldwide for their unparalleled mountaineering skills. They are the backbone of every successful expedition to the world's highest peaks, guiding climbers through the treacherous terrain of the Himalayas. But beyond the fame of the mountains lies a story of resilience, culture, and struggle, one that is rarely told. Sherpa culture is deeply rooted in Tibetan Buddhism, with a strong emphasis on community, spirituality, and respect for nature. For centuries, Sherpas have lived in harmony with the harsh environment of the Himalayas, cultivating a unique way of life that blends ancient traditions with the demands of the modern world. Their language, customs, and religious practices are integral to their identity. Festivals like Losar and the Tibetan New Year are celebrated with vibrant dances, music, and rituals that have been passed down through generations. But behind these rich traditions, the Sherpa community faces significant challenges that threaten their future. In the remote regions where Sherpas live, healthcare access is limited and the quality is often inadequate. The rugged terrain and extreme weather conditions make it difficult to reach medical facilities, and even when they do, the resources available are minimal. For a community that lives in such an inhospitable environment, this lack of healthcare infrastructure is particularly dangerous. Compounding the problem is the shortage of Sherpa specialists in fields like medicine. Drawn by the income that going into mountaineering and the porter industry offers, many young Sherpas leave behind their education early in order to pursue these opportunities. This is discussed by a Sherpa tour guide named Kaji Sherpa. Kaji had to leave his education to support his family's farm, from which he pivoted into being a porter.
As a farmer, I work with, I have support to my parents. When I live there, I go to school when I was a child, kid. Nearby the home, like primary school, till 5 class, grade 5. And I dropped my education after that. So when I was getting older, then after I decided to go to Turkey as a porter. First of all, I did as a porter about 4 to 5 years.
Education is a primary area where Sherpas face challenges. Schools in the Solukhumbu region are often underfunded, with limited access to qualified teachers and educational materials. Many children must walk for hours each day to attend school, and the quality of education they receive is far below the national standard. For those who do manage to continue their education, the path beyond primary school is fraught with obstacles. The cost of higher education is prohibitive for many families, and the lure of immediate employment in the trekking and mountaineering industry often outweighs the uncertain benefits of further study. Some families are lucky enough to afford these ventures. The son of Kaji Sherpa, Furi Sherpa, is an example of this, as a person who took advantage of his opportunity by pursuing a bachelor's degree in computer science.
I had very good educational support from my family, and as well as all those required supports from my family in terms of food, shelter, and everything is.
Many of those who are lucky enough to attain higher education end up leaving Nepal and Solukhumbu in order to work for more monetary gain elsewhere. Dr. Mingmar Sherpa is not one of these people. As the first Sherpa physician from Solukhumbu, and one of the few who returned post-education in order to give back to his community, Dr. Mingmar broke new grounds within the field of rural healthcare. Dr. Mingmar pioneered the use of ultrasound technology in the Khumbu region in order to reduce maternal mortality rates. By detecting high-risk pregnancies early, he has saved countless lives. Recognizing the scarcity of physicians in these remote areas, he has also trained thousands of nurses to perform these vital procedures, empowering them to serve their communities effectively. We had the privilege of speaking with Dr. Mingmar Sherpa to learn more about his groundbreaking work and the challenges he faces in delivering healthcare to the Sherpa community. And can you tell me a little bit about what life was like growing up in Solukhumbu?
Uh, I was Solukhumbu when I started school. When I started school, there were no school at all. There were no school at all in my village. My village, in the whole district, we didn't have any school. We didn't have any school in our district. So my father brought a teacher from some other district, and he started teaching me at home. So later, after a few years, there were some small school, kind of primary school, started at the district. And then slowly it became middle school, then junior high school, and then I studied up to class 9, my village, Solukhumbu. And after that, because there were no other facilities to study further, so my father took me to India. So I was in India for 3 years. And women, pregnancy, say pregnant women die because of various complications. And those days, I had one ultrasound machine. The Ministry of Health gave me one ultrasound machine, and I was never trained for that. But I studied myself. I studied on the book, and I practiced my own. And I started doing ultrasound in the village to detect abnormal pregnancies and do surgery or refer them to some bigger hospital, family. So that was how I started. Because the maternal mortality, most of them can be prevented. That is preventable. And in Nepal, lot of women were dying from that. Lot of mothers, the women who used to die from complications of pregnancy. So I did all these things, and when I was at the hospital, I did it on my own. I learned it.
When you became a physician, what made you decide to come back to Nepal and work and help the community instead of going into private practice in India or somewhere else?
Those days in Nepal, private practice was not that common. But when I started, say 1979, 78, 79, private practice was not that common. And number one, when I studied myself, when I went to medicine, medicine is a service. It is not medicine is not taken as a business those days. And even now I feel that it is not a business, it is a service kind of thing. So I was never interested in business, using medical profession as a business. I don't remember charging any penny to any patients up till now. I've retired, and even after 10 years after it, I have never charged any patients anything. So I always tried to have. I did quite a lot of surgery, and a lot of things also. I don't remember charging anything, even at the hospital or anything. So
much of the challenge within the Solukhumbu region comes from the lack of support that the Sherpa community gets. This is a direct result of Sherpas leaving Solukhumbu to study further and not returning. After getting higher degrees, physicians from Sherpa communities go into private practice in more developed areas and tend to leave behind their rural homes, a sentiment observed by both Dr. Mingmar and Kaji Sherpa.
A lot of doctors, they have gone to US or UK. A lot of doctors have gone away, and they have joined private practice or say any other. They are not in Nepal.
Yeah.
They have not come back. They have been working. My own relatives, I know quite a few. My own relatives, they have spent 30 years there, and now they are coming here, come to Nepal for trekking, say golfing around, for, going to say hiking, kind of like that. But they are not interested in working in Nepal. So
education is like most of the young children, so young people, young generation, when they finish the high school level or college level, most of the people are moving to another country abroad for study. But they don't want to stay in Nepal, so because they're thinking that here is no opportunity. That's why they're moving to other country abroad for the study.
There is a way to address these challenges of healthcare and education in the Sherpa community by taking these issues upstream. While much of the problem is rooted in the economy of Solukhumbu, a significant challenge lies in the perception of what it means to be a hero in Sherpa society. For generations, mountaineers and climbers have been celebrated as heroes. Their incredible feats on the world's highest peaks are admired and revered, inspiring young Sherpa children to follow their dreams in their footsteps. These climbers are seen as superheroes, embodying courage, strength, and determination. But imagine if the next generation of Sherpa children also saw doctors, engineers, and educators as heroes. Imagine if they looked up to people like Dr. Mingmar Sherpa with the same admiration and aspiration. By shifting the narrative, we can open up new possibilities for these children, possibilities that extend beyond the mountains and into the fields, that can uplift and empower their communities. This shift in perspective begins with education and community engagement. By highlighting the achievements of Sherpa professionals like Dr. Mingmar, we can show young people that there are many ways to serve their community and become heroes in their own right. It is crucial to encourage and support young Sherpas who are interested in fields like medicine, engineering, and education. These professions are not just important, they are vital for the future of the Sherpa people. By nurturing these interests, we can ensure that the next generation is equipped with the skills and knowledge needed to address the challenges their community faces. The path forward is not just about maintaining the rich cultural heritage of the Sherpas, but also about expanding their horizons. It's about creating a society where the next generation is inspired to pursue a range of careers, contributing to a sustainable and thriving future. The true heroes of the Sherpa community are those who dedicate their lives to the well-being and advancement of their people. By elevating these role models, we can inspire the younger generations to aspire to greatness, not just on the world's highest peaks, but in every field that strengthens their community. The future of the Sherpa community lies in the hands of the next generation. By redefining what it means to be a hero, we can ensure that the challenges of healthcare, education, and opportunity are not passed down, but are instead transformed into stories of success and empowerment. As the sun rises over the Himalayas, a new day begins, one where the Sherpa community continues to climb, not just to the summit of mountains, but towards a brighter, more equitable future for all.